Okay, today we're going to get started on chapter 9. So if you will, follow along with your PowerPoint and then in your textbook as well. We're going to start with organs of the digestive system. Just to do a A&P recap, you have your mouth, salivary glands, pharynx, esophagus, stomach, liver, gallbladder, pancreas, small intestine, large intestine, rectum, and anus. Those are all of your organs of the digestive system. You have a slide that shows you like an animation of the digestive system, which is really good, so make sure you watch that video if you have a chance. A lot of we have several different names for the digestive system. We call it the gastrointestinal system. That's the official name. The gut, the stomach. There's different names for it. And then you have the alimentary canal as well. And you also have 30 feet of continuous intestines, muscular tubing basically between the mouth and the anus, and that's a lot. If you take it's all kind of smushed in there all together. But in order, you're going to start with the mouth, then your food is going to go to the pharynx, and just let me start over with the mouth. This is the first step in the digestive process. This is where particles start breaking down. Then it goes to the pharynx, the esophagus to be swallowed, and then that goes into the stomach. Then the small intestines, and this is where all your nutrients are absorbed. Then it goes into the large intestine where it forms like a stool, basically. Then to your rectum, and then it's defecated through the anus. So that is the process in the order of the digestive process. The main functions obviously is going to be digesting food. You're going to have the chemical and physical breakdown of your food into smaller portions so it can go through your tubing. And then this is going to create glucose, triglycerides, cholesterol, amino acids. This is your digestive system is highly important. Like I already said, absorbing nutrients happens in the small intestines. And then after the nutrients are absorbed, it's absorbed into the blood, which goes throughout the body and distributed throughout the body. And then eliminating waste, obviously, is in the large intestine. All those broken down waste in little particles are slowly formed and exited through the anus and then the rectum. Or the rectum and then the anus. So, let's go on to the digestive process. So, as I already said, food starts breaking down in the mouth, and that's the actual first step in digestion. The tongue moves the food around the mouth and mixes with saliva, and that helps break down the food. And then, of course, the roof of your mouth, you have the hard palate and the soft palate. And then hanging down from the soft palate is the uvula, and this helps in speech production. And this is where you gag. If they ever have to swab your throat for strep or something like that, if they touch that, that's what makes you gag. The cheeks are your lateral walls, and this helps distribute the saliva around the mouth. The lips are, of course, are your opening. And then your entire oral cavity within your mouth is lined with mucous membranes to get that saliva and those secretions going to the enzymes to start breaking down the food. Going into the pharynx, after the food leaves the mouth, it enters the oropharynx, and then it's the laryngopharynx, and then you have your epiglottis. Your epiglottis is going to cover the larynx and the trachea to make sure it's going to close the trachea so it will not go into the lungs. And sometimes it does happen, inadvertently, but it shouldn't be going into the lungs. It should go into the stomach. So that's how it's the function of the epiglottis. But sometimes we can get choked. We can get a few particles in our lungs. The esophagus, of course, is a muscular tube. It's 10 inches long in adults. You don't really have to know that for test purposes. And food enters from the pharynx and delivered to the stomach. So it runs all the way from the pharynx all the way to the stomach. And it's propelled by wave-like motions, and the cilia that lines the esophagus helps propel the food down. And then the muscles kind of peristalsis, mainly in the intestines when it gets there, but the whole action is called peristalsis, where it will keep the food moving. Then it goes to the stomach, and this is a J-shaped muscular organ. It's going to collect the food, and then once it sits there for so many minutes, it'll start churning the food, and it'll start producing those extra enzymes like bile to help break down the food further. Then it will start the digestive process, and then it stores food as well. There's three parts of the stomach. You have the fundus, which is the upper part, the body, which is the main part, and then the antrum, which is the lower part that lowers into the other parts of the digestive system. Then those folds that are in the stomach and along the intestines is called the rugae, and these are like little folds of tissue that help propel the food forward. And then in the stomach we have the hydrochloric acid. This is where that forms, and it's secreted by glands that are in the stomach. It mixes with food, and it forms a liquid. All your food forms a liquid, and that's called chyme. And then as that finishes, it passes through the remaining part of your digestive system, and then that leads us to your sphincters. Now a lot of things can go wrong here. You could have a hiatal hernia where your sphincter is not opening and closing as it should. And sphincters is a muscle, and so that's why you can have problems with it. But it controls the flow of food in one direction, but sometimes that food can go back up, and it's called like a regurgitation. And then you have a cardiac sphincter, which is located near the heart. The lower esophageal sphincter is what is really important with digestion. That keeps food from backing up into the esophagus. And when that does happen, like I said, we can create like a hiatal hernia or regurgitation and vomit, or gastroesophageal reflux disease, otherwise known as GERD. Then we have the pyloric sphincter, and this as well opens and closes, and it allows small amounts of highly acidic acid to go into the small intestine. So it goes in just a little bit at a time and deposits the acid. And so that's what that is. Then we get into the small intestines, otherwise known as the small bowel, and we have the duodenum, and then we have the ileocecal valve, which connects the ileum to the colon, and then we have the ileum, then the jejunum, and this is the longest portion of the canal because, like I said, this is a lot of intestines kind of packed in all together. So it is the largest portion. Going on to the colon. The colon is 5 feet of the 30 feet. So you have about 20 to 23 feet of regular small intestines. The colon extends from the ileocecal valve to the anus. And then you have your cecum, and your appendix is located by your cecum. Then you have the ascending colon, where the colon goes up, the transverse, which goes kind of across and dips in a little bit. Then you have the descending colon, which wraps around. Then you have the sigmoid colon, which is the very bottom portion of the colon. So whatever fluid remains is going to harden at this point, and it's going to deposit it into the large intestines. Most is reabsorbed into the body. And then you have your solid waste, and that's going to be your feces or your stool. And this is going to be evacuated when you have a bowel movement. Then we get to the rectum and the anus, and of course the rectum is a storage spot for the feces, and it leads to the anus. When we have the urge to go, it will go into the anus and out of the anus. And this process is called defecation. Alright, now let's look at the accessory organs which play a vital role in the digestive system. We have the gallbladder, the liver, the pancreas, the salivary glands, and all of these help break down those enzymes and create enzymes to break down the food and keep it going. So we're going to start with the salivary glands, and you have 3 pairs. You have your parotid, your sublingual, and your submandibular. And all of these produce saliva. They allow food to be swallowed without choking. But of course, sometimes you do choke accidentally. When saliva is mixed with food, it's called a bolus. And it contains amylase that begins digestion of carbohydrates. So remember, amylase will help digest carbs. Then you have your liver. This is the largest organ in the digestive system. It's located right up here in the right upper quadrant, and it processes the nutrients that are formed, and it detoxifies the harmful substances, and it produces bile to help in the emulsification process of your food being digested. Your gallbladder, we can live without the gallbladder. However, it can cause some diarrhea and upset stomach without it. But your gallbladder stores bile within it, and gallstones can form occasionally, which is the main cause of people to have their gallbladder removed. Women is more increased risk for gallbladder stones or gallbladder removal, and a lot of times women that have vaginal birth are usually going to be more prone to have gallstones or something going on with the gallbladder. And so you may notice that people that have had vaginal birth are going to be more frequent to have gallbladder issues. And then of course being obese can increase the risk as well, because you can have cholesterol that accumulates and causes a stone, or triglycerides or something like that that can cause stones in the gallbladder. Then the pancreas cannot be taken out. It's probably one of the most important organs. And this is going to digest your fats, your carbohydrates, and your proteins. And the pancreas is also an endocrine gland. So when we get to the endocrine system, we will talk about the pancreas as well. And the pancreas is responsible in producing insulin and glucagon. And this is going to regulate the glucose in your blood. So people that are diabetics, they're going to have a problem with the pancreas. Let's see, let's go on and talk about, to the next slide, the digestion. We've already said that digestion is the mechanical breakdown of food that begins in the mouth, then it passes through the pharynx or the throat and into the esophagus. It moves down the esophagus to the stomach, and then at that point proteins start digesting, and then you start developing large molecules. And then you have the sphincter muscles at the juncture of the esophagus and the stomach, and this is going to prevent regurgitation. However, sometimes it will not function correctly. At that point, the stomach will secrete gastric juice that contains enzymes and catalysts that act on protein and breaks down the protein. And again, gastric juice does contain that hydrochloric acid that activates all of these enzymes that help break down the protein. The acidic gastric contents would be very irritating to the stomach lining if the lining weren't protected by mucus. And sometimes people can get ulcers, peptic ulcers, mainly, where they have too much acidic contents in the stomach, and it can start eating a hole through the wall of the stomach, and it goes even through the mucosal membrane that's inside of it. Then again, with the small intestine, this is where food goes to the pyloric sphincter, and this is going to acquire hormone signals, and the hormones are going to help the sphincter to open and then relax and close again. So this is where chyme comes in, and it's propelled along by peristalsis. We already talked about how the greatest amount of digestion occurs in the small intestines, because this is where all your nutrients is going to be stored. And then the liver, we have bile that forms in the liver, and it's stored in the gallbladder. So bile is going to enter the duodenum through the common bile duct, and bile, remember, is an emulsifier, so it's going to help in the emulsification process. And this is going to produce large fat droplets that are going to start making that liquid turn hardened to help go through the large intestine for defecation. When digestion is complete, the nutrients are absorbed into blood capillaries in the intestinal wall. Let's see. Let's go on. We're going to go on to vomiting. Vomiting, everybody hates it, but it is actually a protective mechanism of the digestive system. So when any harmful substances are in the digestive system, it's going to make you regurgitate to in hopes to get it up. Now, when you have a stomach virus, it's because you have a bacteria or virus in there, and that's going to help get rid of the virus. So it is good to use Pepto-Bismol, but if you really want it to be as short-lived as possible, you should try not to keep from vomiting and let it come up on its own to get rid of it. Vomiting is also controlled in the medulla. Let's see, vomiting. You know, of course, we don't really have to talk about this, but nausea usually occurs before vomiting. It's very rare that somebody is not going to be nauseous before they vomit. Usually you have about anywhere from like a 2 to 5 minute warning. The salivary glands like secrete, and your throat may feel tightened up, and it's a bad feeling to have, as I'm sure everybody knows. Then going on to diarrhea. Diarrhea results when fluid contents of the small intestine are rushed through the small intestines and through the large intestines, and it makes a liquefied defecation or stool, and it causes a watery stool. So if somebody has an attack of diarrhea, again, the body is actually protecting, and it's trying to get rid of a harmful substance. Pause for 1 second. Okay, sorry about that. Anyway, let's go on to constipation, which is the reverse of diarrhea. Constipation happens when there's feces that remain in the colon too long, and it becomes very hard and stone-like, and it keeps reabsorbing water, and it becomes very hard and dry. When that happens, it's hard to pass it through the large intestine. And then some people that hold their stools and defecation process, these is going to be way more common in these patients than regular patients. So you should always, especially children, they tend to hold their bowels, and so you always want to try to encourage them to use the restroom when they need to, so it doesn't cause chronic constipation. Constipation can also be caused from lack of fiber in the diet. So with a good amount of fiber, it will, fruits, vegetables, cereals have a lot of fiber in it, and so this will help the patient go a little bit better. And then you have constipation can also be side effects and symptoms of certain conditions that we'll talk about in a little bit. Then our first condition that we're going to talk about is hemorrhoids. We're going to kind of go through this pretty fast. Hemorrhoids are varicose veins, and they're enlarged, and they line the rectum near the anus. And you can have internal hemorrhoids, and you can have external hemorrhoids. If you have hemorrhoids, a lot of times the physician will do a proctoscope, which is not a very pleasant thing to have, and it can be very embarrassing for the patient, but it's one of those things that has to be done to make sure it's nothing more severe, basically. Causes of hemorrhoids include constipation, lack of fiber, lack of poor dietary habits, an overuse of laxatives. Teens, that's your big thing right there. Teenage girls especially overuse laxatives. A lack of exercise as well, and straining to have bowel movements can also cause a hemorrhoid to come through the anal opening. These hemorrhoids are very common during pregnancy because of the pressure from the uterus, so that is very common to see hemorrhoids during pregnancy. So treatment for hemorrhoids is just going to be to add fiber. If it's real big and it gets inflamed and infected, the physician may actually remove it. But if it's not really too bothersome, then a lot of times it'll correct itself with proper diet and stool softeners and such. So going into diseases of the mouth, we're going to first talk about stomatitis. And this is a herpes simplex virus type 1. Okay, stomatitis is the inflammation of oral tissue, so like little colds or ulcers within the mouth. So once you have this, you'll always have it. It may go away, but then a year or so later, or maybe a couple months later, it'll pop up again. And usually stress or anxiety can increase the likelihood of this. Streptococci, which is strep or strep throat, strep infection, This this is very common within the oral cavity, and these can cause little lesions around the tonsils, as you know, that can become very painful and cause strep throat. And then, of course, we can also have a gonorrhea infection within the throat as well, and then a syphilis infection. And these can be treated with antibiotics. Usually penicillin is the primary antibiotic used. Let's see. I'm sorry, I told you herpes simplex type 1, but it's actually herpes simplex type 2. So my bad about that. The symptoms is usually going to be like a burning or aching pain within the mouth, maybe hard to eat, hard to swallow, but it is a virus, and usually in about 2 weeks it'll go away. And if it's really painful, the doctor can give you something like Zovirax or something, or some other antiviral to help slow down or help speed up the process, so it will, not last too long, but it doesn't cure herpes. Let's see, you can use like a topical anesthetic such as Oragel or Orabase to kind of numb the area where you can eat and can talk without it rubbing against teeth or something like that. So there is some treatment for pain. Okay, yeast infections in the mouth, or Candida albicans. This is a fungus that's usually in the mouth. Mainly, you're going to see this in infants, and when it's in infants, it's called thrush. And then if adults get it, a lot of adults may get it if they are immunocompromised in some way, or if you take a lot of antibiotics for a long period of time, it can cause this as well. Steroid treatment can also cause a yeast overgrowth in the mouth. Let's see, the treatment for this is going to be antifungal, like fluconazole or nystatin is the big one for children. If they have oral thrush, the doctor will usually give them nystatin. And then we can use diflucan orally for adults. Cancer of the mouth, not very common, but it can happen. But it is one of the 10 leading causes of cancer death worldwide. The most common form of oral cancer is a squamous cell carcinoma, and these are usually going to appear in the floor or the bottom of the mouth, and maybe even the lower lip. So every once in a while you may see some on the top lip, but they're usually going to be down here at the bottom or inside at the bottom is where you're going to find them. The most common cause, of course, is tobacco, using smokeless, or this regular cigarette or cigars. Also, alcohol can increase the risk as well. These carcinomas, if they're on the tongue or the lip, they can be surgically removed, and sometimes you may even have to use radiation therapy. So let's go on to diseases of the esophagus. Sometimes the things that can tell you that something's going wrong with the esophagus is a term called dysphagia, or painful swallowing or trouble swallowing. And this is relatively uncommon. However, cancer of the esophagus can happen, and when this happens, it narrows the inside or the lumen of the esophagus, and this can cause vomiting, dysphagia, like I said, painful swallowing or trouble swallowing. It can cause bad taste in their mouth, or it can cause bad breath as well. And then you'll have weight loss associated with cancer of the esophagus. The esophageal cancer can metastasize and spread fairly easy, but it usually spreads to remote sites, so it's not one of those that will spread quickly, systemically. The prognosis for cancer of the esophagus is very poor, because it is hard to treat since it is in the esophagus. Now we go to esophageal varices. This is another condition, and this is like inflamed vessels within the esophagus, or varicose veins. And what happens is they result from pressure within the vein, and it makes the veins appear, like a varicose vein on the thigh or the leg somewhere. So when you have some kind of liver obstruction, this is when it's going to put more pressure on the veins and cause a dilated tortuous vein to appear. And this is a very common side effect and common sign in cirrhosis. And the main concern with esophageal varices is hemorrhage. They can easily rupture. Swallowing food, it may tear or slowly break down the lining of the esophagus and cause a hemorrhage. Let's see. Let's go on to esophagitis. Very common. It's the inflammation of the esophagus, and it causes burning chest pain. It almost resembles heart attack symptoms, and we call this otherwise known as heartburn. And this usually follows from eating and drinking. And when we have esophagitis, if it is chronic, we can sometimes vomit blood as well. This is where we get into GERD, or gastroesophageal reflux disease, and this is actually a chronic condition where the acid of the stomach backflows through that sphincter and sits in our esophagus and erodes away the esophagus and causes infection and inflammation. Then we can also have a hiatal hernia, and this is when a protrusion of an organ, the protrusion of the stomach through the diaphragm at the point where the esophagus joins the stomach. And the hiatal hernia, a lot of patients will complain that it feels like food is stuck right here, and they may have a hiatal hernia. And sometimes, a lot of people just live with it and they don't get it fixed, but you can have it surgically fixed as well. So the symptoms for hiatal hernia are indigestion, heartburn, and let's keep going to gastritis. We do have acute gastritis and we have a chronic gastritis. The acute gastritis is the inflammation of the stomach, and it's caused from irritants like caffeine, alcohol, cigarettes, any kind of tobacco, or coffee as well. And when we have gastritis, you can commonly have vomit with blood, and that's usually the main symptom that happens with this. To diagnose it, we have to have a gastroscopy, and then of course the PowerPoint tells you that alcohol can increase the gastritis, make it more severe. Then we have chronic atrophic gastritis. So this is the chronic kind, and when people have cancer of the stomach, they can have this chronic atrophic gastritis. And so this is where your intrinsic factor and your hydrochloric acid is secreted, and this is what helps absorb your vitamin B12. So if this happens, you're going to have a vitamin deficiency in B12. Let's see. Going on to peptic ulcers. These are ulcers of the lining of a body surface. So the peptic ulcer is going to be an ulcer of the stomach and or the small intestine. Okay, and then the small intestines is going to be a peptic ulcer, and then the ulcer of the stomach is going to be a gastric ulcer. And then the ones of the small intestines can also be, if it's in the duodenal area, they can be duodenal ulcers as well. So this is caused by an agent called pepsin, which is an enzyme, and it's secreted in the stomach. And what happens is that the acid is regurgitated and irritates the mucosal lining of the stomach. And this becomes, starts leaving a hole or ulceration. With peptic ulcers, you can have a bacteria called H. pylori, or the Helicobacter pylori virus. This does cause the peptic ulcers, and this can be treated with it's not a virus, it's a bacteria, but it can be treated with antibiotics. Complications and side effects, it's mainly just going to be pain when the acid, right after eating, when you're digesting, you'll start having that pain. And then when the digestion keeps happening with a peristalsis of the intestines, it will intensify the pain. So people that have a gastric ulcer are going to have vomiting and nausea and a lot of abdominal pain. Complications, of course, you can have hemorrhage, and hemorrhage can, if you have a lot of blood loss, can lead to shock, hypovolemic shock. So we want to make sure that we try to manage any kind of ulcer at all. Bleeding from the ulcer can cause a bloody vomit, or hematemesis, which is blood in the vomit, or we can have blood in the stools as well. And if we do have a peptic ulcer, any type of stomach or any kind of peptic ulcer, it will make the stool like have a very dark and tarry looking appearance, and this is called melena. We're going to keep going. We're going to keep going and go to gastroenteritis. I'm just trying to do a quick overview of this chapter. Gastroenteritis is the inflammation of the stomach and the intestines, and so pretty much this is going to be the same symptoms: nausea, vomiting, you may have some diarrhea, and even like a loss of appetite, otherwise known as anorexia. With gastroenteritis, food poisoning is one of the main causes of it, and so when it happens, it can happen very abruptly, and you may have to vomit and have diarrhea at the same time. The most common causes of food poisoning are Salmonella and E. coli, and so make sure you remember that. So treatment for this is just going to be to replace all the fluid that you've wasted in the body, and usually that has to be done through IV. E. coli is a common thing in the human body. It's commonly found in the stool, and it's commonly found in the stomach, but when it gets in areas that it's not supposed to be in, then it can cause a lot of problems going on. So if you ingest E. coli, it will make you sick, but E. coli normally found in the stomach that wasn't ingested orally is fine. E. coli normally found in the stomach is usually fine, but if you ingest it by swallowing or eating something that has E. coli in it, then it will make you sick. Food poisoning, you're going to have vomiting, excessive vomiting, diarrhea, you can have fever, chills, so it can be pretty bad. And then, like I said, treatment is going to be to replenish all those fluids that you lost, and just really maybe even give the patient some antibiotics if it is a bacterial infection. Then we can have carcinoma of the stomach. Carcinoma of the stomach. This is usually a very large mass that can invade the stomach wall and make like a protrusion, and then it can obstruct the stomach, which can, of course, cause digestion to slow down or not occur. So we're going to have a lot of pain with cancer of the stomach. That's going to be one of the main causes. And then we're going to have infections as well. A lot of times, cancer of the stomach is not caught until after it's in the last stages, or maybe it's even already spread to the liver, and then the liver carcinoma is what you're experiencing. You may have jaundice or something like that, to where you start noticing a lot of symptoms then. Let's see. Some of the symptoms you may have is blood in the vomit. It can appear in the feces. You may have pernicious anemia, which is a depletion of vitamin B12, because it doesn't secrete that intrinsic factor like it's supposed to. The best diagnostic procedure for this is, of course, a biopsy, but you can have a gastric analysis of your gastric juices, and see if something is within your gastric juices that's causing the cancer. Let's see. Let's go on to another cause of carcinomas in the digestive system, the gastric area mainly, is a disease called H. pylori. And H. pylori can form in the stomach, and damage the mucosal cells. H. pylori is a bacterial infection, but if it's not treated properly, it will put the patient more at risk for those GI cancers. And there is a pretty good prognosis for this condition. Okay, going on to diseases of the intestines. And the first one we're going to talk about is appendicitis. And appendicitis is acute inflammation of the appendix. And usually we may not have symptoms until right as it's about to rupture. And if it ruptures, it can be very life-threatening, a severe infection. So you have to be really careful with this. But your appendix is located in your lower right quadrant. And the symptoms of this is nausea, vomiting, and fever. And then every once in a while you'll have a pain. And this is usually caused by E. coli. Let's keep going. The treatment for appendicitis is just to surgically remove it. And then, of course, we're going to do some, pain relievers as well. All right, let's go into malabsorption syndrome on page 209. This is the inability to absorb fat and other substances in the small intestine. And this can cause very foul-smelling stools. And that's going to be your main sign there to look for. You may have a lack of energy, inability to maintain your a weight. So those are your symptoms. With this, when you pass a stool, it's going to look like a real fatty, pale looking, and like I said, it will have a very foul odor. And the fat from the stool will cause the stool to float instead of sinking to the bottom. So that is one thing that many people have that they may not even realize that they have. Complications from malabsorption syndrome. You can have secondary infections, pancreatitis, or a blocked pancreatic duct. So you have to be careful with that. We may have inadequate bile secretion because of a blocked bile duct. And so this is going to interfere with the whole digestive process and cause like a secondary malabsorption where we don't want one. Vitamin K or potassium. This is going to cause it's going to cause that not to be absorbed, and potassium helps to clot the blood, and so this can cause increased bleeding if the potassium is not absorbed correctly. And then treatment for this is going to be diet control. Make sure we have all those good vitamins, the fat-soluble kind, which is A, D, E, and K, otherwise known as potassium. Then we go on to diverticulitis and diverticulosis. This is diverticula are little pouches that grow in the intestines, and within it they can have infection in it, and it can be pretty bad. And diverticulitis is the inflammation of the diverticula. Okay, so diverticula are the abnormal pouches, and then when they get infected and inflamed, it'll form diverticulitis. So usually this can occur on the small intestines, and these little pouches will have fecal matter in it. And sometimes they can, if they sit there long enough, they can turn to stone and cause a lot of ducts to be blocked. And so it can be very dangerous. In fact, I saw a woman bleed to death in front of me because she had a bleed from it. So symptoms of diverticulitis is going to be cramping pain, diarrhea, usually on the left side of the abdomen is where the pain's going to be, obstruction of the intestines, and we can treat it with antibiotics, and a controlled diet is usually pretty effective. Then we go on to regional enteritis, and this is an inflammatory disease of the intestine that usually affects young adults, most commonly in females. And this is where the intestinal walls become very thick and rigid and hard to digest food through. And it can very much resemble the pain of an appendicitis. So we have to rule that out first. You may have diarrhea and constipation. You're going to have blood in the stools, which will cause the melena. And then you can have some severe diarrhea, which can cause you to actually have to go into the hospital and have IV rehydration. The cause of regional enteritis is not really known, and we can treat it with anti-inflammatories and antibiotics, and sometimes we can treat it with surgery if we have some kind of complication. Then we're going to go to chronic ulcerative colitis. This is a very serious disease. It's an inflammatory disease, and it causes ulceration of the colon and the rectum. So the main symptoms you're going to have with this is diarrhea that has pus and blood and mucus within it. And you're going to have cramp-like pain in the lower abdomen. And then with this, you're going to have periods of remission where you'll have no symptoms, and then it'll flare up and go away, flare up and go away. So that is what chronic ulcerative colitis is. The cause of this is unknown. The treatment is to try to remove stress, because that can cause stress can cause pretty much anything in the body. Foods that maybe each person have said, hey, that's not making me feel very well. So that's just kind of a trial and error type thing. Corticosteroids are sometimes used as well. Surgery can be used, and sometimes it may get it so bad that we have to do a colostomy, where you have the bag outside of the intestine. So we don't want it to get that bad, of course. Alright, then we have carcinoma of the colon and rectum. This is very common, and it's one of the top leading causes of death from cancer in the United States. So this is usually felt when we do a rectal exam at our physicals, and it can be seen with a proctoscope as well. The symptoms of this are usually none until it becomes very, very bad in its last stages. But you may notice a bowel habit change, diarrhea, or you may see constipation. And then as it gets bigger and bigger, you're going to have more stomach issues. A lot of pain and pressure may be felt. You can also maybe have blood in the stools, and a pretty good large amount of blood as well. And then as the tumor spreads, it can go into the lymph vessels and metastasize to other organs like the liver. And then we can have cancer of the colon it can be hereditary, which means it can come from anyone in your family. So you have to be very careful with that. Let's see. Let's keep going to... We've talked a little bit along the way about intestinal obstruction, so I'm going to keep going past that, and we're going to go on to spastic colon. A spastic colon is when the colon is contracting out of control. And this can cause diarrhea, or it can cause constipation, abdominal pain. Gas is one of the big symptoms. And basically the motility of the colon isn't working like it's supposed to be. And so the pain is probably caused by muscle spasms in the intestine, and that's what is called a spastic colon. Causes of this is usually abuse of laxatives, certain foods like caffeine, and drinks, of course, caffeine, alcohol, spicy foods, fatty foods, concentrated juices can cause this. And they can irritate the bowel, so you have to be careful with this. And then, of course, with spastic colon, you do not want to use laxatives. And to treat it, you can add fiber to the diet, and that's been shown to help pretty well. Try to avoid stress, emotional stress. So any kind of stress can cause your stomach to be upset. Anytime you've been nervous about something, you may notice that you may have an upset stomach or a nervous stomach, and that's because of the stress. Okay, dysentery. This is an acute inflammation of the colon, and it is colitis, which is inflammation of the colon. The major symptom here is diarrhea, and the stools will contain pus, blood, and mucus. It's very similar to other conditions, but it is a bacteria. With this can cause excuse me. This can cause a lot of diarrhea, and it can also be caused by a worm, like a parasite or protozoan infection. So we really have to figure out what's going on, which type of infection it is, so we can treat it appropriately. The most thing to do here is to do the most common thing to do here is probably a stool culture, ova and parasites to see what type of infection that it is. Occult bleeding, which is occult meaning hidden. This is a microscopic examination of stool to identify any blood in the stool that may be caused from food poisoning, gastroenteritis, or dysentery. So the general rule of thumb, if blood in the stool is bright red, the bleeding is usually from the distal end of the colon. And if you have streaks of red blood, that can be seen as hemorrhoids. And it can also be cancer of the rectum, but usually it's just hemorrhoids if we have streaking of blood. Then if we have dark blood that make our stools look very tarry or cause melena, this is usually from the stomach or the duodenum. So that's how we usually, if we ever have something going on with bleeding, they'll ask you, is it dark, is it bright red? Because you have to know that. Let's go on to, we're going to skip functions of the liver, but make sure you look over that. And I just want to touch on the diseases. We're going to go to the gallbladder, look over the functions of the gallbladder. One of the symptoms of the gallbladder and liver is a condition called jaundice, and this is when bile is obstructed. The flow of bile is obstructed. And this causes like a yellow appearance to the skin and a yellow appearance in the white part of the eye. Okay, going on to hepatitis, we have a lot of different types of hepatitis. Hepatitis is inflammation of the liver, and it can be caused by, 6 or 7 different things. Hepatitis A, we have hepatitis B, hepatitis C, hepatitis D. Hepatitis E is uncommon, but there is a hepatitis E. So we're going to begin with hepatitis C because this is the one that's going to be the leading cause of hepatitis from blood transfusions, okay, because sometimes that's usually where we can get it. This can cause liver transplants to occur, liver disease, cirrhosis of the liver, and it can persist for months or even years. And usually if you don't have cirrhosis before this, you'll have a pretty good chance of developing it after, which of course will put you more at risk for liver cancer. Hepatitis C is transmitted through blood, so like I said, blood transfusion is the most common place to get hepatitis C. Of course, you can get it from other countries as well. Treatment for hepatitis C is interferon injections. That's the main treatment that we use. Then we have hepatitis A. This is known as infectious hepatitis, and it's the very least serious form of hepatitis. The incubation, well, let's say you don't have to know that. Symptoms of hepatitis A are anorexia, nausea, and a mild fever. And one of the big signs to look for is a dark color or amber colored urine. And jaundice can happen as well with this. And so those are your main symptoms you want to look for with hepatitis A. We can get this from contaminated water or food. And usually hepatitis A is more mild in children than in adults. Hepatitis B is probably one that you're all pretty common with. This is a more serious disease, and we do take injections or immunizations for this as well as hepatitis A. But this can lead to chronic hepatitis and cirrhosis of the liver. This can be from bloodborne pathogens. Let's see, it can be very deadly. Can be spread from contaminated needles or syringes, and can be transmitted sexually through body fluids. Let's see. Going on to hepatitis D, this is a defective virus that's incapable, excuse me, my nose is itching, of reproducing in a cell unless the cell is also infected with hepatitis B. So you're not going to see D. It's more commonly going to be seen if they already have hepatitis B. So this is a more serious type of hepatitis. And then we have hepatitis E, which, like I said, is rare in the U.S., but we include it because there is some times that we will see this. It is more common in Africa and Asia and Mexico. Those are the 3 countries that you'll see it in. And this is usually fecal contaminated drinking water, so their water doesn't go through a purification system basically and can cause this hepatitis. Going on to cirrhosis. Cirrhosis, the main cause is alcohol, but cirrhosis can put you more at risk for liver cancer, but cirrhosis is a sign usually of something else that's going on. Let's see what I want to talk about now. If we have a liver cancer or hepatocarcinoma, this can usually, like I said, be caused from cirrhosis. So the symptoms of this is going to be ascites or fluid developing in the peritoneal cavity around the abdomen, and it's going to be a lot of pressure, bloating, like a pregnancy-looking person's. Is what it's going to make a person look like. And a lot of times you may not notice until it's in its end stages, so it's very dangerous. It will cause jaundice as well. It can cause weight loss, an abdominal mass, and pain at the liver in the upper right quadrant. Usually liver is one of the last places that a cancer will metastasize, and when they've done autopsies, they'll find out that the liver cancer is the reason why a person passed away. Let's see. Let's go on to gallstones. This has to the gallstones can be present in the gallbladder and have absolutely no symptoms, but then they can cause infection and inflammation and have a lot of symptoms as well. These look like little pieces of gravel in the gallbladder. And so what can be dangerous is when it starts obstructing those bile ducts and causes inflammation, then a backflow of fecal matter, and major infection and sepsis. Let's see. Cholecystitis, which is inflammation of the gallbladder, usually from infection. So we're going to have pain under the rib cage. It may radiate to the right shoulder and into the back. We're going to have chills and fever, nausea and vomiting, and a lot of pain after eating heavily fatty foods. Going on to the pancreas, we're going to talk about pancreatitis and pancreatic cancer. So let's talk about acute pancreatitis. This and pancreatic cancer is very deadly, one of the most deadly cancers that we have. But this is severe abdominal pain, and that just keeps going and keeps going. It doesn't have a break in it. It's usually onset very suddenly, and it can radiate to the back. Some of the other symptoms we may have is jaundice. Let's see. Yeah, jaundice is one of the main symptoms. And then we can have some type of malabsorption syndrome as well. Pancreatitis can put you more at risk for pancreatic cancer. But if you don't have pancreatitis and you develop pancreatic cancer on your own, then you will have pancreatitis in most cases along with the cancer. Alcohol consumption is the main cause of pancreatic cancer. Gallstones can also cause pancreatitis, and it can, let's see, the etiology, it says to be idiopathic, but like I said, increased alcohol, pretty good risk factor. Pancreatitis is more common in men at the age of 40 and over. Diagnostic procedures for this is going to be blood test and urine test. If we have high levels of amylase in the blood or the urine, that's going to indicate pancreatitis or pancreatic cancer. An adenocarcinoma, this is otherwise known as pancreatic cancer. High mortality rate, one of the highest, if not the highest. This will usually give you no symptoms at first until it's out of control and has metastasized. It can block the common duct, which is the main bile duct, and let's see, it will cause jaundice, it will cause digestive issues, and so the reason really why we may not see this at first, see the symptoms at first, is because you may contribute it to stress or just a little stomach ache, and then it gets worse and worse and worse until you finally go to the doctor and they discover that it is pancreatic cancer. This, when you do have pancreatic cancer, it will cause like a very fatty, clay-looking stool, and you will have rapid weight loss as well. The poor prognosis for pancreatic cancer is very poor, and usually you can almost count about 99% of the time death does occur. The most common risk factors for this is cigarette smoking, high protein and high fatty diets, industrial chemical exposure, and then alcohol abuse can cause this. And then diabetes mellitus can also increase your risk factors for this type of cancer. Alright, so we're going to stop there. I know I went through this rapidly, but I did. It's a long chapter, and I just wanted to kind of touch base on a little bit of each one.